evening, everyone. I am Richa Sera, and I would like to welcome all of you on our Insta Live channel at Responsible Hospitals. I am the founder of the Responsible Hospitals, and as usual, I come up with a different kind of session. And this time, I have come up with another session. Today, I will be having Dr. Shivanshu, and he is one of the best doctor in the industry when we talk about the respiratory diseases. So he will be talking about a lot of things which are related to ARDS. In a layman term, we will be talking about it officially. I'll be just adding him soon, and we'll be starting the session ASAP. Yeah, just a second. Dr. Shivanshu, can you just see me? Yeah. Hi, good evening.
Hello, good evening. How are you?
I am good. How are you?
All good, all good.
Your
Thank you.
camera seems to be on the horizontal way. Probably if we can just keep it as a vertical side.
Okay. That's okay?
Yeah. Am I audible?
Yes, absolutely. Loud and clear.
Yeah. So, Dr. Shivanshu, it's really a pleasure having you over here because this is the first time we are doing this kind of topic on the respiratory diseases, which is something which is major and we need to discuss upon it. But then we hardly got a chance to discuss on this in detail. So, I think it's a pleasure to have you over here. So, if you can just start with your introduction a bit, and then probably I'll start with the topic.
Okay, right. So, first of all, thank you for having me for this session. I am a consultant pulmonologist at the Artemis Hospital, Gurgaon. The idea is we take care of pulmonology and sleep medicine. So both the specialties come under the forum of the pulmonologist at Artemis.
Right.
So all the respiratory problems, allergy issues, sleep related issues, and when the respiratory issues become critical, so we take care of all that. So I'm based at Gurgaon itself.
Sure. That's great. So, since we thought that we should talk about acute respiratory, diseases and the condition and the post effects. So, a lot of people have started asking us questions that whether it is related to asthma or whether the asthma is a covered part of it or not. If you can just start with this.
Okay. See, asthma is a very common term which everybody knows. The idea about asthma is you can have an asthmatic coming to you or us in a OPD basis. That is what we call a stable asthma. Or the asthma can land up in an emergency department in a very severe attack where we call it a status asthmaticus or a severe attack of asthma, where they even need to sometimes be hospitalized at an ICU level. So asthma is a varied presentations. You have got an asthma which is absolutely stable, doing nothing, just doing normal inhalers, and sometimes even not even on an inhaler. So they can be that stable. And there are patients who are so sick that they frequently need to be put on frequent high dose medicines.
Okay, sure. So when we talk about ARDS, what do you, I mean, full form by, I think everybody would know, but probably this session is meaningful when people understand it in a language of layman. A lot of people
True.
have the disease, but they don't understand it, that what do we call it? When do we need to see a doctor like you? So there I go that what is ARDS, and I mean, how do we call it and understand in a layman language?
Right. Uh, First of all, I would like to say I hope I don't need or anybody doesn't need to see me at least for ARDS. It is such a dangerous situation. I really pray for that. We are here to help everybody, but from my heart, I really do not want anybody to land up into ARDS. That's one. ARDS basically, as you said, everybody knows it's called the acute respiratory distress syndrome. Now, post-COVID, a lot of people have got to know or they've been hearing about this word ARDS. Either their relatives or somebody is admitted to a hospital, and doctors will use the term that your relative has got ARDS. So, otherwise, this is not a very common term for a conversation. It's a medical term which is used mainly and reserved mainly for ICU setup. ARDS is not a community problem. ARDS is a problem where there is severe pneumonia. It affects both the sides of your lungs. both the sides almost start becoming white. And this whiteness of the lung can be because of an infection or can be because of some other reason. And it is so bad that the lungs are not able to maintain their oxygen. Usually, 90% patients of ARDS are on a ventilator or they are on a very, very high oxygen support. That is where we call them as acute rest. This particular term is being used only for patients who have got X-ray or a CT scan which is almost white, and there we have to use a ventilator or a high flow oxygen.
Okay, sure. So, any specific, why does it happen basically?
Right. See, ARDS can happen because of infection or because of a cardiac issue. Like, for example, somebody has got a cardiogenic ARDS or a non-cardiogenic ARDS. In a non, I will talk about mainly the non-cardiogenic part, will not go into the cardiac part. The non-cardiogenic part is, for example, viral diseases. As you know, now we know about COVID.
Yeah.
Earlier, we had a problem called the swine flu. Then we have got bacterial pneumonias, fungal pneumonias. All these problems affect the lung and they cause so much of infection or inflammation in the lungs that they develop solidification. That means what happens, if you have heard, our lungs are basically a mixture of air sacs called alveoli. These alveoli become filled up with mucous material or fluid and it stops exchanging oxygen. That is where we call as ARDS.
Okay, sure. So, since you just mentioned about that, how does it take place? And does it happen anybody specific to any age group, or does it happen to the kids, or probably on senior citizens?
See, ARDS can happen to anybody. It all depends upon your immunity. It depends upon the grade or the intensity of the infection. For example, let's talk about COVID because nowadays people have heard about COVID. Somebody gets exposed to the virus. If they are not vaccinated or if their body is not able to fight against the virus or the load of the virus is so high that immediately the viruses start multiplying in the lungs and your body starts fighting against the virus. In this fight between the virus and the body trying to protect itself, it causes damage in the lung. The damage is being created by a fight happening of you are trying to protect yourself, the virus is trying to damage you. That is where the problem happens. But when we talk about age, every age will have a more commonly they'll have because of the viral and bacterial problems. Old age people can have more cardiogenic problems.
Mm-hmm. And what are the symptoms of this?
Okay. So the main symptom is that you will not be able to maintain your oxygen level. You will be very, very breathless. For example, a patient who does not know he has ARDS, he comes to the casualty of any hospital. The main concern the patient will have, the patient is not able to breathe. They are finding it very difficult to breathe. They will suddenly tell you that, put me on oxygen. When you put them on oxygen, still the oxygen level is not going up. It's a classical sign of ARDS. Despite of giving oxygen, oxygen is not going up. That means the lungs are affected. So this is the patient where they will go to the ICU. They might go on a ventilator either through the tube or a mask ventilator. And what we do, we give pressure. By pressure, we try to open the lungs, and through the pressure, we give oxygen. That is the idea.
Okay. So when you talk about that, this is a disease wherein they have to land up urgently to the hospital since there is no way around. And we have seen such cases in COVID wave 2 happening because they
Absolutely.
had no other reason and people were buying oximeters and trying to check
True.
at home. So what do they do at home? Probably, see there, you understand that being in Gurgaon or a metro city, it's always mostly, it might be a difficult case to reach on time to see a doctor.
True.
Any certain suggestion you would like to give it at that particular point so that we can just save that one life?
Okay, so I can give you suggestion how to manage the problem in the initial stage, but with a word of caution that the once the ARDS has set in, that time it's not a home management at all. Once the ARDS sets in, that time the management has to be in a hospital. But before that, once you know that you're feeling uneasy, you first obviously check your oxygen level.
Right.
If the oxygen level is low, if you have oxygen available with you, either in the form of a concentrator or in the form of a cylinder, you start yourself on the oxygen. Then you must have heard by now that a lot of people have been told to lie prone, that is to lie on your stomach.
Right.
Why it helps? Because ARDS mainly affects the lower areas of your lungs. So when you lie prone, that means when you lie on your stomach, these affected areas they go up and you'll be able to ventilate your lungs properly. So that is where the oxygenation improves. Even in the hospital setup, we sometimes the ARDS is so bad that the patient is not maintaining oxygen despite being on a ventilator. So patient has to be kept ulta. That means the patient is kept prone,
Okay.
even on a ventilator.
Okay. Okay. So, well, when you say that they see a doctor, they get into the hospital, they admit themselves. How does the recovery part takes place? How much time does it take for them to get well? Does it take a
Okay,
day or it might vary from person to person? What is the process basically?
okay. See, ARDS goes ahead in various phases. It starts from, if I can use three medical terms called the exudative phase, proliferative phase, and then the fibrotic phase. So
Okay.
the idea is first there will be a lot of damage, then this starts getting organized, and when it starts healing, the fibrosis starts settling in. That is where you must have heard people of COVID who were on ventilator, eventually they developed fibrosis. That was the reason. ARDS patients do not recover in one day. That's a wrong thing. If somebody who has recovered within one day, then it was never ARDS.
Okay.
ARDS patients will stay on ventilator for some time. Then you immediately, the ventilator is not treating you. Ventilator is just giving oxygen. Then you start your treatment, whether viral, whether bacterial, whatever, and that treatment helps for the disease to recover slowly and gradually. Sometimes it takes a week, sometimes 2 weeks. We have had a patient of COVID with us who was in the ICU for 2 months, 3 months,
Yeah.
but still they recovered. Still they recovered.
Okay. Okay. Somebody is asking that why it is called a syndrome, not disease.
Yes, it's a very, very important question. It is not a disease. Why? Because it comes with lot of other problems. It is a multi-system issue. The idea is once you have an ARDS in your lung, your body is not getting oxygen. The other organs are not getting oxygen. The kidney is not getting oxygen. Heart is not getting oxygen. Muscles are not getting oxygen. So you start developing multi-organ dysfunction. Your kidney levels will start going down, your urine output will start going down. So everything starts getting affected because your lung is the gateway of oxygen for your body. If your lungs are not functioning properly, the other organs will not get blood. So it is overall a syndrome. And when you recover out of ARDS, that time also there is so much of muscle weakness. People go into depression. People go into post-traumatic stress. All this together is called a syndrome.
Sure. And let's say if they are recovered once, do you think it can land up again in their life?
Okay. See, it is something like if I give you an example, it is like an injury. Suppose if you fall, you get hurt,
Right.
you can again fall in life. So it is something of that sort. So you have got a problem in your lungs. With God's grace, with everybody's effort, you have recovered. But you can still have it again. ARDS is not something like that, it will give you immunity for life. No.
Okay.
But that is what we always say. Be healthy, have very good diet, nutritious food, so that your body is able to fight the problems.
Sure.
People who are diabetics, people who are cancer survivors, people who are very old, they become very high risk for this.
Okay. Okay. And since you just mentioned about the diet and nutrition part, I would want to know more that how could, because we do not have a habit of getting a lungs checkup done,
Right.
in mentality people, they still are not aware. They are even aware, I would say, but they're not used to going for checkups, maybe because of fear and whatsoever. So how do, because other than that, we may maintain the diabetic, oh, we are diabetic, we keep on checking. We are BP patient, we keep on checking. When it comes to
True.
lungs, which is
Yes.
has really brought up when COVID came in the picture. Or else people were, they were like, okay, it's okay, it doesn't matter, really. Is there any way wherein they can just go through a process or a simple test which can just help them to understand, you guys are fine now? Or in case there is little bit they need to take care, they can start from there.
I'm really happy you really asked me this because, till COVID came, not many people used to even talk about lungs, and hardly anybody realized that there is any importance of lungs. People knew about heart attack. Nobody knew about lung attack. The lung
Right.
attack is basically ARDS. When you have got severe problem in the lung, it is called a lung attack. Now, when you ask me the second part, that how do you know and how do you get your lungs checked up? First thing is that since we are living in Delhi NCR, the amount of pollution we inhale every day and the kind of AQI we are breathing, the everybody's lungs are affected. That it is beyond imagination. That right from the first breath of a baby to anybody, and over that people smoke. So you are creating so much of toxicity in your lungs. How do you get a checkup done? First and the foremost thing is whoever doctor is known to you, a pulmonologist, a physician, a family physician, any friend, talk to them. Do not leave any symptom unanswered. Any cough of more than 2 weeks duration can be a severe problem. It can be TB itself. Never ignore your symptom. If you think you are breathless on climbing a stair, ask your doctor. If you think your cough is so much that it is, that you're very troubled by your cough more than 2 weeks, always be careful. Meet your doctor. There is something called a lung function test available. That's called PFT, pulmonary function test. It is a very simple test where you blow into a computer and it gives you the finding that this is the capacity of your lungs. That's one. And suppose if you have done an X-ray or a CT scan, your doctor, especially a pulmonologist, will be even able to look inside your lungs by a means of a small camera called the bronchoscope. You must have heard about people going for endoscopy for
Right.
stomach. It
Yes.
is something like the endoscopy for lungs is called bronchoscopy. It is
Bronchoscopy.
not a major procedure. It is something which we do every day. I'm not saying everybody should come and do a bronchoscopy, but lot of diseases can be diagnosed by bronchoscopy, and many diseases can be even treated by that.
Wow, that's awesome. Good to know, because a lot of people, they must be having such kind of, I'm sure, symptoms, but they might be like ignoring that. So
Exactly.
rather than landing up to the final situation, they should just go and see and get it done.
Yeah,
So
I would like to add a small point. A lot of people, we see patients who come to me in a lung cancer stage 3, stage 4, because they have been ignoring their symptom in stage 1 and stage 2. Small cough happening, small breathlessness happening, they just keep ignoring it. At that point, nobody can help them. So they should come early to the hospital. Suppose if you are above, I'll give you a small mantra. Anybody who is above 50 years of age, anybody who has got a history of cancer in their family, anybody who is a smoker should definitely get once in a year lung checkup done. You never know where you develop or you are at the starting stage of a lung cancer where it can be simply operated and removed from your body.
sure, very, very important, very well said. So adding to the point number one, which you just explained about the test, you also spoke about that, breathlessness. I mean, when you say that, I don't think people understand this. A lot of people think when you, of course, climb upstairs, सांस फूलता है. लेकिन they don't
Right.
understand कि what is that point that they should be judged in a way that there is some problem, they need to get it checked.
Okay. See, the idea is you need, see, everybody has a different capacity. See, there are athletes who can run, they're running marathons. You cannot compare everybody like apples and oranges. Like,
Right.
for example, I am a person. I go to my office or I go to my clinic or anybody who goes to a shop. They are doing the regular activity, but the moment they decide my daily regular activity is going down, I am getting breathless in going to my normal shop. For example, earlier, if my house was on the second floor, I used to climb like this, but now I have to stop for my breath. So, for example, there is a runner who says कि पहले मैं I used to run for five rounds of a ground, but now after the third round I'm becoming breathless. That is where you should start thinking that there is something happening. Because if I give you a data about a parametric that has no meaning for normal people, they will not be able to apply that. They should do it from their everyday life. That suppose, and I would strongly suggest that out of 24 hours, at least half an hour to 1 hour devote on your body. At least go for morning walks or any walk whenever possible. 30 minutes of a brisk walk every day is a must. I'm not saying to do walk in a dirty atmosphere, but whenever it is possible, when the atmosphere is clean, you must give it to your body. So many diseases can be avoided in that.
Sure, sure. And since we just spoke about all the pointers, but you want to give any tips to the people who are already going through with this for them?
Uh, the ARDS
Talking
you're
about
talking about?
ARDS. Yeah.
Right. See, first of all, as I told you, people of ARDS will be in the ICU. I'll be giving tips for people who have recovered from
Done.
ARDS.
Yeah, yeah.
So the idea is people who have just recovered from ARDS, they have to understand sometimes they are not able to understand why am I so breathless now? Why am I so weak now? Why am I not able to get up from my chair? And why do I need assistance for everything? That's a normal recovery process. Do not get depressed because of that. Because when you are on a ventilator, your muscles are not working. For the muscles to get their tone back, it needs a lot of time. So this is called a critical illness myopathy. You are slowly and gradually going to come out of it. Lot of time anxiety and depression comes along with people who are recovering from ARDS.
Right.
Again, I'm telling you, we need to counsel them. Two, three things are more important. Follow the medicines, what they are taking, very good amount of nutrition, high protein diet, adequate hydration, having good amount of water, and along with that, physiotherapy. Physiotherapy plays a huge role. That is called rehabilitation. It could be muscular rehabilitation, pulmonary rehabilitation, cardiac rehabilitation, even mental rehabilitation. All these things put together takes role of the recovery process.
Sure. I mean, this was really, really nice session. I think it was really informative because people who are watching and who may watch later, I'm sure it will create a lot of awareness among them that it should not be ignored and it should be something which should be taken seriously and what all they can do to get it
No, I
done.
think really I could play some role in spreading some amount of awareness.
Yeah. No, thank you so much. It was really great, Dr. Shivanshu, having you here. Probably we
Thank
might
you
do
so
it
much.
another one on a separate topic which might be related to the same. And
I
we will talk on that soon. Thank you so much for your time.
thank you so much for having me.
Thanks. Thanks. Bye bye.
Bye bye.